when you say herbal medicine to
Yeah,
somebody, to a layman, it's
yeah,
it's like, oh, you know,
yeah, yeah.
what, oregano or something, or paprika and things like that. Like, it's no, 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 no.
Uh,
It's much, much more than that.
the
It's
paprika is, if you like, a herb. It's a spice. Oregano's a herb, um, and they've got very specific reasons. Think of herbs as plant products, not Chinese herbs where they use things like seahorses and spider venom and things like that. I mean, I don't know, not against it, but I don't know quite how that works. But think of the herbs as plants. They can be leaves and roots and bark of some trees, that sort of thing. But think of herbs as strong vegetables, very strong vegetables in some case. Now, the herbs you buy from the high street or your local, um, even the local supermarkets sell it, they tend to be powders or teas or tinctures. Tinctures are liquid herbs, and the instructions will tell you how many drops to take and how many times a day. Um, excuse me. I do use tinctures, but most of my herbs are what are called fluid extracts, and they are several times stronger than tinctures. They're
yeah,
initially a little bit more expensive, but actually they're pro rata, they come out cheaper because you use far less of them than you use tinctures. So a tincture or a fluid extract is just that, a fluid form of the herbal medicine. And I use single herbs sometimes, but mostly I use formulas. Um, Maybe three, four, possibly as many as five herbs in one formula. And they're all, the way I work, they're all individually formulated because everyone is different. I show
yeah.
my students, iridology students, pictures on the computer of identical twin sisters. And you really can't tell them apart facially, but their eyes are slightly different. When I say eyes, it's the irises, the coloured part, that matters. And their eyes are slightly different. So they need different treatments, different herbs, different advice. Yeah. We're all different, even identical twin sisters, they're different. So I cannot,
Well, no two
but
irises are the same.
no two irises are the same. No. That's why they're used in security situations quite a lot, at the airports and
That
yeah. Then no, there's never two the same. And your right eye is different to the left, etc. And lots of differences. Those differences are very meaningful, very meaningful. We could do
So let's
if
put this into a little bit of context before we dive a little bit deeper. Just so we're
yeah,
talking about then iridology,
yeah.
which a lot of people are not familiar with. So let's touch on what iridology is, and then we can talk a bit more broadly.
Okay. No, that's fine. If you want to, we could do a webinar on iridology and herbal medicine, and we could go into this.
Yeah, we could do a completely separate.
Yeah.
Yeah, sure.
But iridology, if you look into yours or someone else's eyes, look at the coloured part in the centre. That's the iris. That coloured part it'll be grey or blue or certain shade of brown. It might have white areas. It might have some areas with large areas of pigmentation. And all of these signs and colours mean something to the iridologist. My eyes have a lot of what look like holes. They're called lacunas. They're very meaningful, but not everyone has them. They're not a sign of illness. They're a sign of lack of energy running through those areas, which could result in a health challenge if you do the wrong thing.
Yeah.
Now,
So just to clear something up, so because a lot of people would say, well, how can you determine someone's health by looking at their eye?
well, what you
And
could
so,
certainly, well, there are many other signs. There are signs of pigmentation. There are different lines, different ring forms, and about 95% or more of these signs, they're not signs of good health or bad health. They're signs of that person's constitution. Most of them you have at birth or by the time you're 5 or 6 years of age. Some of them don't appear until with some people in their early 20s. But most people, by early childhood, they got all the signs in their eyes which help an iridologist to determine that person's constitution. That's why I would know that this herb is good for that condition rather than this other herb is good. And different types of eyes have different needs, you see. The blue eyes,
Right.
in fact, and the grey eyes, they're called lymphatic eyes. Those people tend to have more problems with lymph system, kidneys, skin, and mucous membranes. The dark brown-eyed people have more problems to do with their liver, gallbladder, and the blue eyes and the brown eyes tend towards different, for instance, digestive problems. Now, we've all got these organs in our body, apart from specific male and female related organs, we've all got the same organs, but these are tendencies towards. So let's say, I'll give you an instance, a young man comes to me with a skin problem, let's say what the doctors call psoriasis. A blue-eyed person would need certain herbal formula and certain dietary advice more than a brown-eyed person who would want very different herbs and possibly very different advice in order to get the results we want. That's the simplicity of it. Yeah?
Right.
Then,
Okay. So
then we add to that.
Yeah, go ahead. Go ahead.
Well, then we add to that different signs in the eyes. That's based on colour alone. When we look at different signs in the eyes, we can say, actually, this organ is under a little bit of stress. There's a little bit of acidity in this area. There's a little bit of pain and inflammation in this area. These are all things that can be seen. So you've got the basic constitution and you've got a lot of information about what's happening energy-wise, energetically, in the various organs. So if I see an energy need in the kidneys and the lymph system, and this guy has got psoriasis, I know exactly which road to take with this person. Can't be any other. That's the way it works. Yeah, that's the way it works.
And so for simplicity purposes, then you could say that this, whatever a person is experiencing, if whatever their health challenge is, it appears on the eye.
Well, you can see the eyes throw up the questions that the practitioner has to ask, because the eyes do not show illness. They are not diagnostic in the way a blood test or a liver function test is diagnostic. They're definitely not diagnostic in that way. It's an assessment technique. It's an assessment of the chi, energy, chi, ki, prana, whatever you want to say, in the body, the inherited energy, and what it's been doing. There are no good eyes or bad eyes. It's what you do with what you've got. If you've got blue-grey eyes with white plaques, which we would call uric acid eyes, and you're determined to have food which is full of uric acid, and your life is full of stress, which amplifies uric acid uptake, you're going to get uric acid-related problems. And that could be joint problems, maybe what the doctors call arthritis or gout, or it could be digestive problems, acidic reflux, that type of thing. Or if you're unlucky, it could be both. But if you're going to go against your constitution for long enough, you are going to get those problems unless you're very, very lucky indeed. Yeah, it's the way it works.
I see now. So the constitution then is sort of the makeup of the person, in a sense.
It's the basis. It's the basis. Yeah, it's the basis. I'd love to.
From there, then you establish then, like, sort of what areas to go into, or how they might react to things.
That's right. I saw a 8-year-old young lady on Saturday, I think it was, in Glastonbury, and I said to her mother, the problems are based in the diet, although I can give some herbal medicine to help, but you really should be advised that this person, this young lady, should never have dairy products. Never. Really bad. She got 2 signs and 1 possible sign that her body just didn't like dairy. And her mother agreed. She said she's always worse when she has anything with milk or cheese in it, and she's coughing and mucus sticks. And her mother agreed. But if I could see children at an early age, not too early, but 6, 8 or whatever, you can plan out their constitution and tell them what would be really good for them and really probably bad for them for the rest of their life, because the constitution doesn't change that much. Doesn't change that much.
It's the genetic makeup of the person, isn't it?
The genetic makeup, exactly. I think we could clarify this whole subject by maybe, if you choose to do another podcast, and put some pictures up and of people's eyes.
Yeah, we will. Yeah, we'll make a whole one dedicated to that, and we'll go into it in great detail. Definitely lots of pictures and everything else, because this is
it would be a great
to see this.
Yeah, we can do all that. Yeah. So that's the basic, really. People come to me, and people like me, and they have a consultation. They get their eyes read. I normally photograph people's eyes and show them on the computer, enlarged versions of their eyes, and then we go through all the points that are really necessary. Maybe do some metaphysical work, and then I can urge them, please take responsibility. Even if you choose to have medicine from the doctor, that's fine, but take responsibility for different areas in your life, and then make the change. Not always all at once. You can make changes gradually. We don't want to give people too much work to do so that they give up, And a lot of people need minor changes to make a big difference. It's that migrating bird syndrome again, change direction a little bit and you'll end up in a different place. And if you do it naturopathically with diet and herbs, you're not likely to end up in a worse place by any means. No, not by any means.
Also, I wish more people understood that, because it's like when you take the route of, the normal, we'll call it the normal route.
Yeah.
It creates more problems along the way. Whereas if you just take the route that's less taken, we'll call it the route that's less taken, then the problems seem to fade away.
Yeah, you've got the choice. I mean, I always say to people, what you do today determines what you'll be like tomorrow. Will you be a little bit better, or will you be a little bit worse? Because it can't stand still. The only thing is change. That's the only constant is change.
The only constant, yeah.
Now, as I said earlier, I'm nowhere near perfect, but I'd sort of tip the balance in my favour and follow my constitution, have done for many years, and have a few pleasure foods, and but I'm not perfect, but seem to be getting on reasonably well. Still working, and hope to continue working. Yeah. There's just
you're having a lot of success with the patients that you've had as well.
I'd be happy for anyone, any doctor or any therapist or any patient, to look at any of my patient notes with the patient's permission or without identifying them, of course. I'd be very happy for them to read the results on absolutely any that I've got in my file. I really would. Yeah.
Yeah.
There's the odd one
without using the word cure. I mean, I know I just said the word, but without using it in the sentence.
Yeah.
What kind of success rate would you say that you have?
It varies enormously. Only doctors are allowed to cure. Therapists aren't allowed to cure. Neither are we allowed to claim to help with named medical conditions, such as psoriasis. So we have to be generic and say, well, yes, I can help to improve the condition of your skin. Now, everyone is different. If a person has an illness which they're dealing with at an early stage, and if they do as they're advised, we normally get quite quick results. I've had people phone me up after 2 weeks saying, I haven't had a migraine since I saw you. Do you see? But if someone is like a lady I can think of at the moment in Glastonbury who had hair loss, Her hair was falling. Well, we identified the type of hair loss, we identified the cause, and it didn't improve for, I would think, maybe getting on for 6 months. And I urged her to, this is this is hair growth. You know, it's not going to work quickly. I told her that from day one. 6 months or maybe a bit less later, she phoned me up for more medicine and said, it's getting better. It's getting better. Also, my nails are improving. Also, my energy. You know, I get people who come for, let us say, joint pain and inflammation, and I give them a balancing formula, and they phone me up a few weeks later or come for another consultation, a follow-up, and they say, I didn't tell you this, but it's gone away. I'm sleeping better. I've got more energy. My libido's better. But I didn't tell you, but it's gone away. Well, that's because we've given them advice which balances their constitution more, and the herbs which are sort of balancing. Many of my herbal formulas have got the code BAL on it. That's a balancing formula. And I expect results, and I expect people to say, I didn't tell you this, but it's gone away. Get that all the time. But as far as telling people, they all ask, how long will this take? And I say, I don't know. You've got to be honest about it. I don't know. The more you do, the better I plan this formula for you, then the better you will get on. It's as simple as that. I normally say, give me a ring a couple of weeks after receiving the medicine, before if you want to, and let me know how it's going on, and then we'll take it on to stage 2. You know, that's very often the way it works.